Hi, very good evening. I'm Dr. Madhumita Gupta. I'm consultant reflexologist and counselor. Let me introduce myself. I did my reflexology. I did from iTech London, and I did MD in alternative medicine and specialization in reflexology. I did my psychological counseling diploma and PG diploma course. Reflexology is an alternative treatment which is not very common name in India, but it is very popular in Europe and America. But India is not very far. It is catching up very soon. When you do something which 10 people has already done or they are doing, so you are not different. And when you do something different, you stand out. So I decided to practice reflexology, which is completely different, a new alternative medicine. So that's how I started practicing reflexology. Now let me tell you what is reflexology. Reflexology is as an alternative treatment or supportive treatment which is very effective. Okay, and it involves the massage on the pressure on the reflex area on the sole of your feet. I can see lot of people, Mr. Gupta, I can see Prerna, I can see Nitin. Hi everybody, thank you for joining. I can see Rajesh Nair. Hi, thank you. Reflexology is the alternative treatment, supportive treatment, which involves the pressure and the massaging on the sole of your feet on the reflex area of your body anatomy. Anatomy means organs. This kind of treatment or this massage or this pressure which we apply during the treatment session, it designed to release the blocked energy and to improve the blood circulation to that particular organs. Okay, and so that the body's own healing process it can improve. Now let me give you a small history of reflexology, how it came, what is it, from where we got to know this. From ancient text we get to know that Egyptian, Indian and Southeast Asia, they used to use reflexology, or they used to walk on the sole of the feet to promote health and to cure some disease and ailments. Kamagani Hukum, thank you for joining. So there was an Egyptian physician, his name is Angkor Mat, and his tomb was in south of. We can see evidence of reflexology on the wall of his tomb. Okay, dated back to 2330 BC. That means we can understand that it's a very old form of treatment. As I said, it was initially known as zone therapy. So Dr. William Fedland in 1987, he was an ENT surgeon in USA. He used to practice in Venia, and he discovered that this kind of treatment, that reflexology, putting pressure on one part and the other part is getting numb, or it's inducing anesthesia on the other part. So he started using this technique to treat his patients and doing the major surgery also. Okay, in 1917 he started writing a book called Zone Therapy. In 1930, there was other lady, her name was Eunice Ingham, who is known as mother of reflexology, foot reflexology. She actually started treating patients. She was a physiotherapist and she started treating patient using this therapy, and she was getting very good result. So she they designed this map on the sole of your feet. That is how it called foot reflexology. As I said, it is a zone therapy. It used to known as zone therapy. Then Dr. William, what he did is he divided our body in three parts. One is shoulder zone, one is waist zone, and third one is pelvic zone. Okay. Now, what are the aims and benefits? Why reflexology I'm talking about? Kaushik ji, namaste. Thank you for joining. The main aim of reflexology is to stimulate your body's own healing process, to improve the blood circulations, because all our organs in the body, systems and the organs in the body, they depend on two things. One is blood supply, because blood carries everything: nutrients, hormone, enzyme, oxygen and medicine. And the second thing is nerve impulse, which comes from your brain, which carries the instructions from your brain to the organs. So reflexology, it improves the blood circulation so that blood can carry all these things and go to the smallest part, is the cell of your body. Okay, organs and the systems still, but the cell of the body, and stimulates body's own healing process. Most of the cases, 75% of the disease is always stress related. So reflexology, to improve the efficiency of our body, we need to improve the blood circulation. As I said, blood carries everything: nutrients, hormone, enzyme, oxygen, and if you are taking any medicine, and the medicine to the target organ also. Okay. So it improves the waste elimination in the body. Waste is like sedimentation in the body. So time to time we clean our house. So this waste removal is something like that. It helps to release nervous energy so that nerve impulse can work better. Okay. So now I tell you that when the patient comes to me or for anybody, what we do first, we do a consultation sort of thing. That is, what is consultation? That means we check few things. One is his personal details. We ask for the personal details. We ask his lifestyle. We ask his food habits, whether he smokes, whether he consumes alcohol or late night or whatever it is, the lifestyle, the food habits, his medical history. It is very very important to know for me to the what I am going to treat. So the medical history is very important. And lastly is stress level. Stress level, we always ask, if you want to put yourself in the scale of 1 to 10, where you want to put yourself. If they say it's less than 5, that means we can understand that person's stress level is more or less okay. If it is more than 6, then it is definitely very very high. So other than all these things, what we check is the feet. So because we walk on the feet, why we walk on the feet is, the feet is very sensitive. We always cover our feet with shoes, socks and all these things. So feet is very sensitive. There are more than 7,000 nerve endings on the sole of your feet. The map is very very clear. There is a map on the sole of your feet. It's a mini map of your body organs. Okay, so we always prefer to walk on the feet. So we check the feet also. What we check? We check the muscle tone. If the feet is soft, that means the whole body, the entire body's muscle tone is very soft. that person is tend to put on weight very fast, flabby or something like that. Then color of the skin, color, that the color of the sole of the feet. So if it is pinkish, that means we can understand that blood circulation is good. If it is white, then definitely poor blood circulation. Then warmth, temperature. If it is warm, then it's good. If it is not warm, if it is cold, that means the circulation is not reaching there properly. Then the flexibility of the joint. You can judge a person if you see the flexibility of that person's feet. If that person's feet is very stiff, that means he is very rigid person. He prefers to stick to his idea only. He doesn't have that open mind to accept the other ideas. Okay. And then the dampness. Some feet are really damp. That means they sweat a lot. That indicates that there is some either hormonal imbalance or that person is very nervous. Okay. And the other thing is smell. Lot of feet, they smell very bad. That means that their kidney needs lot of purification, because the blood goes through kidney for purification, and all the waste product, if it does not go out of your body, that it remains in kidney, it gets stuck there. So smell, we check the smell also, and we check the hardness, if there is any hard skin anywhere. It's a lot of time it happens that some area of your feet is very hard. There are a lot of dry skins. That means there is some posture problem. We put lot of pressure on that area. Okay, so all these things we check before we start the treatment. Now I tell you the reaction, what it could be, what you can expect after a first session. I can get to see Carolyn, and she knows what it is because I worked with her in Calcutta long time back. Hi Carolyn. Now come back to the point. The reaction, what I can expect is sometimes after the first session you may feel very tired. You just go home and feel like just lying down or sleep. That does not mean that you have really any serious problem. Don't worry. Second thing is urination. You may feel like going to loo quite frequently, more than the normal how many times you go in a day. Or you may get a soft motion. When you clean your house, everything is up and down. So we clean lot of stuff, and we try to take it out of the house. This urine and this stool, it helps to remove the toxins from the body, and of course the sweat. Then if you have sinus or migraine, you may get running nose after the first session. It can change your sleep pattern. Most of the people, they sleep very well after the first session. Some of them, it's very rare, but some, they get little disturbance, but that does not mean that it will last for a very long time. Maybe a couple of days, but after that, when your body get used to it, that some changes is happening in the body, so body will get used to it. Okay, and you will get back your normal sleep pattern, you will sleep better and all these things. And the last and one more thing is, it heighten your emotional reactions. Some people, they become very emotional during the sessions. They try to talk lot of things, their pain sometimes, they share their emotional things they want to share. Some people, they just close their eyes and try to just relax. Some people, they try to concentrate what I am doing, and they ask me to explain what I am doing. So I try to explain them that what I am doing, which organ is this, why I am doing this organ, I'm working on this organ, why I'm coming back to this organ again and again and again. It depends that what ailment he or she has. Then the if you have back pain or if you have pain in your body after the first session, it may go up. It may, normally it does not, but it may go up, and that does not mean that it is not working. This treatment is not working. It is not. It may happen that after the first session the pain has gone down and you feel very happy. That does not mean you are cured. You cannot be cured in one session. So you have to be patient. You have to come back for a session again. And it takes little bit of time for body to adjust. Now I tell you that day, why I tell you something before I go to the second point. Why I choose this subject today? Because I spoke on anger management yesterday, and I told you that how anger can respond or react on your body, physically and mentally. So I told you what happens when you are in angry, when the adrenal rush is high, what happens and what you can get in the long run, what kind of disease and disorders you can get in the long run, I told you. So now I come to that point. How many organs, how many systems we have in the body? As a human being, we should know that how many systems we have in the body. First and foremost is our nervous system, that is the brain. Brain, it's very important because all the instructions comes from there. So a very common disease or a very common thing I get is stress migraine, which is very common nowadays, and not even nowadays, it's a long time. There is a two reason behind this stress migraine. One is emotional aspect and the other one is too much of acidity in the stomach. Second thing is sciatica. Second thing is coma, stroke. After stroke, patient may go to coma. I can give you an example of stress migraine. She was our neighbor in Nairobi when I used to stay in Kenya, and she told me once that she has very severe migraine and she has to be hospitalized on and off. And doctor told her that there is no cure, so you have to live with that. She just told me that this is my problem. And I told her very casually, come, let's see if I can help you out. She is a single mother with 3 boys. So you can understand, and she has to maintain house, she has to maintain 3 boys' education, and she has to maintain her job also. So she came for sessions, and after third session, she told me that she's feeling better. Head is lighter and the intensity of pain has gone down. And after 6-7 sessions, I'm still in touch with her, sometimes back also, and I asked her, do you still get migraine? She said no. And when I'm really very stressed, then I get very heaviness but not migraine again. Now I come to the next system, that is respiratory system. Okay, before that I tell you some more, one more example of a coma patient, which is a milestone case in my life. In 2012, I got a patient who came from Yemen. He had hydrated cyst in the brain. I can see your expression that what the hell it is. The same expression I had when I got the case history. It's a hydrated cyst, means is the fluid field cyst in the brain. One cyst inside the other cyst. It's called daughter cyst. It's a very rare case in the world. That point of time it was only 34 cases and Mumbai had one. So when doctor told them that we cannot do anything more than that, after the operation he was in coma, you take him back home. But the attendant, the brother who came with the patient, he was very adamant. He said, my brother will go out of this hospital by walking only. Then I came into the picture and I started sessions. After every session, I used to just look at him and I just try to find out, is there any change? It took 4 long months. I was with him every single day, 4 long months, and you will not believe, after 4 months, he actually walked out of the hospital. That was the milestone case in my life. Now come to the next respiratory system, that is the breathing. Asthma is very common nowadays. Okay, a lady came with a pump. She has acute asthma, and she told that I have only 3 days in hand. If you can do something, please do it. After the 3rd day session, she told me that I did not take pump in these 3 days. Normally, one pump lasts for 3 days only. So this was the case, and I was very happy to get this kind of feedback. Now come to the circulatory system. Circulatory in the sense blood circulation, that is heart. Hypertension is very common thing. High BP, it's like a status. I have hypertension, I take high BP medicine, I take diabetes medicine. It is very common thing nowadays because of our lifestyle, because of the stress. We cannot do anything about this, but reflexology can help you to reduce the adrenaline secretion. At the same time, it will help you to reduce the maintain the BP also. Now come to the lymphatic system, that is called immunity in the body. Immunity is the soldier of the body. It's like soldier in the border. They don't allow any enemy to enter our country. So your lymphatic system is like that. Fluid retention is very common with elderly people. They get swollen, the feet and the ankle get swollen. All these things are very common with the elderly people. Hay fever, sinus, which is also very common because of pollution. It's an allergy. You get early in the morning, you get running nose for some times, then you have your tea, and over the period of time, and then it gets better. And sometimes people sneeze, and 3, 4, 10, 20 sneeze at a time. It is very painful for them and for the other people also. And I know somebody who was on anti-allergy medicine for 7 years. I'm talking about 2007, and now 2020, he is not on anti-allergy medicine anymore. Lot of people, you know him. He's happened to be my husband. And he's Mr. Gupta. Now come to the digestive system. Common gastric ulcer, all these things is very common thing, and diarrhea, constipation, it's very common thing. And one more thing is IBS, that irritational bowel syndrome. It is mostly stress related. Sometimes you get diarrhea, sometimes you get constipation. This is called IBS, irritable bowel syndrome. Then come to skeletal system. Skeletal is the bones and joints. Okay, so skeletal system, spondylosis, which is a very common thing. This neck, they are in between two joint. There is a cartilage patty. It's something like burger patty. So spondylosis, what happens is that get pressed. I have an ongoing patient who is a jewelry designer, and because she works on computer continuously, she get this spondylosis, and of course mobile phone, we cannot deny that. So and it is so severe sometimes that she gets pain, starts from here and the whole hand, sometimes both the hands, sometimes just one hand. She cannot sleep on her right side. After the 3rd session, She told me I'm sleeping on my right now. Okay. Now come to the muscular system, that is muscles of the body. Fibromyalgia, it's a very new name. It's a alien name for a lot of people, but actually it is not. It's a inflammation of muscle fiber. It's very difficult to diagnose because people think that you don't have anything, you don't have pain, you just acting. Your family members, even doctors, it's difficult for them to diagnose, but reflexology can help. It can reduce the swelling and the pain also. Now come to the endocrine system, that is the hormones in the body. Type 2 diabetes is very common, and diabetic neuropathy. Diabetic neuropathy is when you take diabetes medicine for a very long time. What it happens is your extreme areas like feet, they don't get proper blood circulation, and the nerves, they start dying. Okay, so one point of time it happens that you cannot feel, even the floor you cannot feel, you cannot walk, that you are walking as if you are walking on a cotton or something, or on the bed. And this is very dangerous, because if you have any kind of ulcer or cut, and it may lead to gangrene or amputation. Next come to urinary system. Incontinence is very common in ladies who is 50 plus. Incontinence after menopause. Incontinence is after the menopause, the estrogen, which is the female hormone in the body, which become the less, secretion become less, so the muscle tone become less, and the urine, the bladder, which is made of muscle, it becomes a little loose. So when you sneeze or when you laugh, urine comes out. So all these things is a very common disease which can be managed with reflexology. Now come to the point is reproductive system. Infertility is very, very pronounced nowadays, male and female infertility. I work with few IVF doctors in Mumbai. I get lot of patients from them, and they come to prepare their body. They start little beforehand, in the sense they start before their stimulation injection starts and till their egg pickup, so that they can prepare your body, they can get better results, better follicles and all these things. Nowadays doctors, especially the IVF doctors, they are suggesting so that the patient can get the better result. If I don't mention this, then I cannot end the topic. That is cancer neuropathy. Cancer is very common nowadays. So, when you start chemotherapy, you develop lot of tingling in your hand, in your feet, burning sensation, sleep disturbance, digestive disorders, your hormonal imbalance, anxiety, depression, lot of things. Even the chemo is over, but still you get all these things. So we can actually manage with reflexology. I get lot of patients, chemotherapy, during chemo or after chemo, they go through reflexology sessions to manage all these things, because they cannot take lot of medicines. Okay. So friends, this is what is reflexology, what I practice. That is my core area. And now you know what it is and how it works on your body and what it does. And you know that if somebody says that he or she did reflexology, so you can relate what he or she is saying. Okay. I hope you enjoyed these sessions. I hope I can make you understand this new thing, new concept, new alternative medicine which is coming up, which India is coming up with this very, very fast. So I hope I can make you understand without using any technical words. If still you have any inquiry, please feel free to call me or message me, or you can visit my page Madhumita Gupta, reflexologist. You can ask any question and I'm ready to answer. I would love to answer your questions. Till then, I will take a leave and stay safe, stay at home, and thank you for hearing me out. And goodbye. I will come back again. I will let you know the date and time again when I'm coming back with a new topic. Thank you so much and goodbye.